I'm back again. I'm going to show you a really cool technique. It's basically a skull massage. Now, this is not like other skull massages that you might see on the internet. This is basically working on this suture right through in here. It's called a sagittal suture. A suture is a joint. Now, this joint is, in some people, it's fused. And some people, there's still some fibrous tissue in there that can expand very, 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 very tiny amounts. But what you're going to do is you're going to basically take your thumb and you can start here. And this is the back. We're looking at the top of the skull right here. And I'll walk you through it. But basically, we start back here and we inch forward slowly. And we're pressing this way from back to front slowly. And I'll show you the amount of time that you need to do this as well, because we're going to demonstrate this. So why does this work? I have no idea. All I know is it's going to make someone feel really good. I've done this in my practice thousands and thousands of times, and it really gives people a lot of relief. It'll help them sleep. It'll actually help them breathe better. It reduces stress. You just have to try it. You do need another person to do this on you, because you can't do this to yourself, because you have to be fully relaxed while you're doing it. You just need a chair, and I'm going to walk you through it right now. Check this out. Okay, so I'm going to show you on a person, but let me just first show you on my friendly skeleton right here. You can see the suture here. There's one right here that comes up right here. You're going to be taking your thumb, okay, and you're going to be coming forward this way, okay, slowly. You're just going to kind of use traction to go forward, and you're going to hold that, okay? And you're going to hold the front of the forehead with the other hand, and we're going to press these together and gingerly, slowly inch up this way, okay? And I'll show you on the person, but this is kind of what you're doing. You're just kind of creating a kind of a space or more relaxation along this line right here. Okay, so that's what you're doing all the way to the front right here. Let's show you on an actual person. But we have the sutures, that one that goes right up the center. There's one right here. There's one right here. So you're going to take your hand, stabilize the forehead, and you're going to take your thumb right here. And we'll start right here. And we want to push forward. Okay, so like forward. We're going to inch our thumb forward through here. And we're just going to hold this and apply traction and just hold that pressure just like this. So I'm pressing forward like this, okay? So I'm taking it, there's some slight pressure on the skull, but I'm actually going forward like this. I just wanted you to see the subtleness right through here. So I'm going to hold this for a little bit, and I'm supporting the skull. Now I'm going to inch forward right down the center as I'm following that suture. The most important thing is you don't mess up the hair, because you're going to really upset Steve. Now, the only time that you wouldn't do this is if someone actually got hit on top of the head, and that would be painful because you don't want to press on an old injury. So I'm kind of slowly inching forward like this, kind of like doing this. And he should feel like the head is relaxing, the skull is relaxing, in theory.
Oh, it feels terrific.
Good. And if you had injury to your head, let's say on the left or the right, this is essential. There's a small amount of connective tissue that is in this joint right here. Of course, when you're a baby, there's a space there, and then it closes down pretty good. I mean, there's a chance that it could be fused as well. But now what I'm doing is my thumb is getting sore, so I'm going to bend it up here and help with this thumb and press it forward like this. You see what I'm doing there?
That feels really good.
Yeah. And I'm just inching forward, probably a couple minutes. You ever get hit in the head, Steve?
Well, as a little kid, you know, if you shave my head, it looks like the moon from all the knocks on the corner of the coffee table. But
right.
No serious injuries, I guess. Stitches, yes.
Now I'm getting towards this area right through here. Okay, good. How does that feel?
Oh, just fabulous.
Nice,
really good. Really relaxing. I can tell you did all the work.
Exactly. Now I just have to kind of make your hair. So that's simply how you do it. Start here, inch forward, slowly go forward. That's all you need to do. Go ahead and try it. Put your comments below. Hey, if you're liking this content, please subscribe now, and I will actually keep you updated on future videos.